The United States spends more on healthcare than any other high-income country. So why aren't we the healthiest? It's a paradox that sits at the heart of the American experience, a system of world-class innovation that often fails to deliver world-class care for everyone. We have the best doctors, the most advanced technology, and groundbreaking research, yet our life expectancy lags and chronic disease rates are soaring. This isn't just about statistics. It's about the real, lived experiences of millions of Americans caught in a system that promises much but often delivers frustration and financial ruin. We need to ask the tough questions and confront the uncomfortable truths about why more money doesn't mean better health. The story of American healthcare is often a story of debt. It's the illusion that having insurance means you are protected, a belief shattered by the first unexpected medical bill. For countless families, a single health crisis becomes a financial catastrophe. Deductibles are so high they feel like a second mortgage, and surprise charges from out-of-network providers turn a routine hospital visit into a source of crippling anxiety. You can do everything right, pay your premiums on time, and still find yourself underinsured, facing thousands of dollars in costs that your plan simply won't cover. This constant financial stress isn't a side effect of the system. For many, it has become a defining feature, forcing people to choose between their health and their savings. Beyond the cost, there is a fundamental barrier to access. Where you live in America can determine the quality of care you receive, or if you receive it at all. A vast gulf separates well-funded urban medical centers from the struggling clinics in rural communities. In many parts of the country, hospital deserts are a growing reality, forcing residents to travel hours for basic medical services. This geographic disparity is compounded by a national shortage of primary care doctors and nurses, the very backbone of a healthy society. The wait times to see a specialist can stretch for months, turning preventative care into crisis management. This isn't a system that serves everyone equally. It's a patchwork of haves and have-nots. Even for those who can afford care and have access to it, the system itself presents a formidable obstacle. It is a maze of bewildering complexity, designed for institutions, not for people. Patients are forced to become part-time administrators, spending hours on the phone with insurance companies, deciphering complex billing codes, and fighting for pre-authorizations for necessary treatments. There is a profound lack of price transparency. Asking, "How much will this cost?" is often met with a shrug. How can we make informed decisions about our health when the most basic information is intentionally obscured? This administrative burden adds insult to injury, draining the time and energy of people who are already at their most vulnerable. This is more than just a policy debate. It's about our collective well-being and the future we want to build. The path forward requires a radical reimagining of what healthcare should be. We must move toward a system defined not by its complexity and cost, but by its simplicity, transparency, and unwavering focus on the patient. It's about creating a system where a diagnosis is a medical challenge, not a financial death sentence, and where quality care is a right, not a privilege determined by your zip code or your income. The challenge is immense, but the goal is simple: a healthier America for all.